Hi, my name is Eran Talitman, and I'm a psychologist and the clinical team leader at the Southdown Institute. In this video, I would like to talk about various strategies and solutions in order to manage and reduce our anxiety during this pandemic. Right now, many of us are experiencing a great deal of uncertainty and a lack of predictability. What we do know is when we human beings are experiencing a sense of uncertainty, we tend to really think about the worst possible outcome. We actually have a name for that. It's called catastrophizing. Catastrophizing is when we start to really ruminate and be preoccupied with the worst possible scenario. And this just escalates and maintains our anxiety and stress. It's really important for us and for other people to really be careful that we're not just engaging in catastrophizing, but that we also begin to consider best possible outcomes or other outcomes. And that way we can reduce and manage our stress. The second issue that I'd like to talk about is the notion of a negativity bias. All human beings have what's called a negativity bias. What this refers to is the fact that we tend to be much more impacted by negative events rather than positive events. So that means that we're more likely to recall and remember negative events versus positive events. Some people have mentioned that we tend to have what's called Velcro for negative events and Teflon for positive events. What that means is we tend to hold on to any negative events we've either experienced or witnessed or read about or watched, and we tend to have Teflon, which is to minimize and overlook and disregard positive events. During this time, many of us are reading articles and watching news about the pandemic. What's likely to happen is that we are likely to really be impacted by very negative events, such as the number of deaths or stories of a lot of pain and a lot of hurt. We're also likely to overlook some positive events that have taken place. So how do we combat the negativity bias? The way to combat the negativity bias is at the end of each day, it's really important to focus on at least 3 things that were very positive that we've either read or watched. So that could be scientists who are developing a vaccine, people who are volunteering to help their neighbors or one another. So it's really important that we do that. The third factor that I'd like to talk about is the notion of control. What the research clearly indicates is that resilient people focus on what they can control and not what they can't control. The research is clear that we become more resilient when we become active problem solvers as opposed to passive, helpless observers. So, what can we do? Well, many of us are creating masks, we're engaging in social distancing, we're hand washing, we're volunteering to support healthcare workers. Corporations and organizations are manufacturing protective equipment, and scientists are working on vaccines. The more each and every one of us volunteer to help out in any way, that really speaks to our sense of efficacy and optimism. So I'm encouraging each one of us to volunteer to help out in any way. The next area I want to talk about is social support. Social support is the #1 factor in enabling us to be resilient and to reduce and manage our anxiety. What does social support mean? Social support means that we are able to talk about our thoughts and feelings and our experiences with people that we trust, with people that we feel safe with. Social support is very, very important right now. It is the #1 aspect of being able to deal with this pandemic. So what we do know is, what the research clearly tells us, is that men are less likely to engage in self-disclosure than women. So here's what I'm asking all of you and encouraging you. Reach out to everybody that you know and to ask how you're doing. Initiate conversations. And if you get a response of, well, I'm doing fine, thank you, you can also acknowledge feelings that you're going through, and that may allow someone to realize, okay, I guess it's acceptable to talk about that. I'm encouraging each one of you to contact people that you know, and to reach out, even if it's just a 5-minute phone call, to just say, how are you, how are you doing? That is so important these days. As well, the form of social support can take place for many of you who live in communities. It's really important to be able to spend time together through prayer, dinner time, recreation, or social activities. The next notion or issue I'd like to talk about has to do with developing a predictable routine. Many of us who are at home might feel confused, aimless, not knowing what to do with ourselves. We might have not established a routine because our lives have changed. What the research is really clear is that when we develop a predictable daily routine, this helps us with a notion of control and predictability. So, your daily routine might look something like this. For some of you, you might have work to do, and that might be part of your daily routine. Many of you are engaging in prayer, and that should be part of your daily routine. For those of you in community, you really need to have community prayer. Recreation is also really important, so make sure that for those of you in community that you really set up lots of recreation time, whether it be board games or cards. That's also a really important part of our daily routine. Social time. Make sure that we reach out and talk to lots of people on a daily basis. And the last thing I will say about a daily routine is exercise. Research is really clear that when we engage in at least 30 minutes of exercise, we just cope so much better. Exercise tends to reduce our stress, our anxiety, our tension, and it actually boosts our immune system. So it's really, really important that exercise be part of our daily routine. The next idea I do want to talk about is, while many of us need to find information by going on the internet and watching the news, and so while that is important to be up to date with what's happening in the world around us, I am encouraging each and every one of us to limit our exposure to the news. Constantly reading or watching the news only can aggravate us and makes us feel tense. It's important that we contain it and only watch when we're really looking to obtain some information. I'm really encouraging all of you to not either read articles on the internet or watch the news just prior to going to bed, because that will increase your anxiety and tension, which can make it difficult to fall asleep. So I'm encouraging all of you not to watch the news or to read articles at least an hour or two prior to bedtime. I'd like to share some breathing techniques with you and that you can share with others. The first breathing technique has to do with counting to 4 on the in-breath and counting to 5 on the ex-breath, on the out-breath. Okay, so what I'd like you to do is to find a quiet place and to close your eyes. And when you found a quiet place and you're closing your eyes, I'd like to take a big inhale of a breath. And as you're doing that, count to 4, to hold it. And then as you exhale, to count to 5. You could keep doing that for about 5 minutes. The reason why that's really important is because research indicates that when we're tense or stressed, we breathe very shallowly. This helps us to regain a sense of deep breathing. Another form of breathing exercises, again, entails finding a quiet place and closing our eyes, and then just attending to our breath. Just notice the sensation of breathing in and out, either through our nostrils or through our chest or through our stomach. We're not trying to change our breathing in this exercise. We're just paying attention to our breathing. Simply 5 minutes of being quiet and listening to our breathing helps us to slow down and not be ramped up. I do want to also talk to you about mindfulness. Mindfulness is about paying attention to what we're experiencing in a non-judgmental way. So for us to be mindful, once again, we need to find a quiet place, to close our eyes, and just pay attention to our body and just pay attention to our thoughts or feelings without judgment and without trying to manipulate or control what we're going through. The reason why mindfulness is so important is because it helps us to slow down, slow ourselves down, and it prevents us from reacting impulsively by reaching out, let's say, to alcohol, to food, or just surfing the internet aimlessly. Being mindful gives us a pause. And when we pause before we react impulsively, it gives us a chance to say, how do I want to react in a more healthy way in this moment? I also want to talk to you about gratitude. Research is really clear that for people who are happy and resilient, they tend to engage in gratitude. I am encouraging each one of us to take the time and really reflect on who and what we're grateful for at this moment. So for example, we can be grateful for all the healthcare workers who are trying to help us and protect us. We can be grateful for government leaders who are working around the clock at trying to solve these problems. We can also be grateful for people who love us and care about us and contact us and support us. We can be grateful that many of us are healthy and safe. We have food and we have shelter. Research indicates that when we really focus on gratitude, we tend to be more calm, more peaceful, and more resilient and happier. As well, research indicates that when we engage in even small acts of kindness, that actually helps us to be happier and more resilient. So I'm encouraging all of you to engage in small acts of kindness, to reach out, even if it's just a phone call, to say hello, I'm here for you. Little things that people might need, for example, for the elderly who are not able to leave their property, to maybe do some grocery shopping or send an email that you're thinking about somebody. These are small acts of kindness that actually benefits both the receiver and the provider. Another thing that I do want to talk about is that in times of stress and anxiety, when we're struggling, many times we can engage in a lot of harsh or self-judgment thoughts about ourselves. We can be harsh and judgmental towards ourselves. Research indicates that that's not very helpful. So for example, right now, we might be distracted. We might be, it might be difficult to concentrate. We may not be having a lot of energy or motivation to get things done. And so we might get frustrated and we might be judging ourselves right now. This is not helpful. What is helpful is what researchers name as self-compassion. That is that when we're struggling and having some difficulty, it's much more effective for us to engage in self-compassion, which includes being kind, gentle, encouraging, and supportive towards ourselves, just as we would for someone we care about. So if you're not sure how to react to yourself in a compassionate way, I have one simple question for you. What would you say to someone that you really care about who is experiencing the same thoughts and feelings and struggles that you are? If you can answer that question, then you're likely to be more self-compassionate. I do want to talk about some of the warning signs that we're not doing well. Um, in interacting with others, whether through video conferencing or on the phone or perhaps in person, I'd like you to pay attention to some warning signs that we might be noticing. For example, engaging in excess alcohol use, irritability, low frustration tolerance, insomnia, or perhaps isolating or withdrawing from social contact. These are signs that somebody is not doing well. And if you're aware of that, it's really important to be able to reach out and ask how someone's doing and to let them know that you're there. So I'd like to close by, first of all, inviting all of you to Southdown's website, where we have provided numerous resources for coping and dealing more effectively with the pandemic. I also wanted to let you know that we at Southdown have established a helpline. And this helpline is free to all religious and clergy who might be struggling with the pandemic. The phone number for the helpline is 289-763-1478. And I do want to close by saying, keep well and stay safe. Thank you.